Common drug interactions that are harmful. Sometimes taking 2 medications at once can increase your risk of adverse side effects. It's important to be aware of these potentially harmful drug interactions. Blood thinners and ginkgo biloba. Blood thinners, especially warfarin, can have a deadly interaction when combined with the herbal product ginkgo biloba. The most dangerous risk is that these two together could cause a person to have an adverse bleeding event. HCTZ and licorice. HCTZ is designed to be a diuretic to combat fluid retention, while licorice can cause a person to retain fluid. There may also be additional issues considering licorice can cause potassium depletion. Antihistamines and Dramamine. You probably shouldn't combine antihistamines and Dramamine together. This can cause extreme fatigue and drowsiness that will make it difficult for you to do just about anything, and we certainly wouldn't recommend getting behind the wheel. NSAIDs. NSAIDs can go under a variety of names, so it can be really easy to take too many without realizing it. Taking too much of this medication could cause damage to the stomach lining and stomach bleeding. Antidiarrheal medication and calcium supplements. You should never take antidiarrheal medications and calcium supplements together. The results could be disastrous, as you could be faced with some rather severe constipation with a vitamin supplement and medication working together to harden stool. St. John's wort and cold, flu, and sinus relief. St. John's wort can interact with cold, flu, and sinus relief medications like NyQuil by causing a buildup of serotonin in the body. When too much serotonin is built up, you could develop serotonin syndrome, which can manifest in a few different ways, potentially causing diarrhea and body chills. Blood thinners and ibuprofen. Ibuprofen is a drug that can cause stomach bleeding, and blood thinners are a drug that already increases your risk of bleeding. Your safest bet is to talk to your doctor before combining these medicines. Multi-symptom cold and acetaminophen. Multi-symptom cold products already contain acetaminophen, so it's important not to take any additional drugs containing it. Taking too much can cause liver damage in the body. Antidepressants and NSAIDs. Antidepressants and NSAIDs can come with an increased risk of bleeding, making these two kinds of medications you may want to avoid taking together. A form of antidepressant called SSRIs, when combined with NSAIDs, can also cause adverse gastrointestinal effects. Vitamin B complex and statins. When taking any kind of statins, you should always talk to your doctor before you take any supplements along with it. The combination of vitamin B3 and statin medication can worsen symptoms of muscle soreness. Statins and oral fungal medication. Statins and oral fungal medications, like clarithromycin, ketoconazole, and itraconazole, can cause increased levels of statins in the blood, which in turn will worsen the side effects of statins. Moreover, it can cause myopathy symptoms such as muscle weakness, cramps, spasms, and stiffness. HCTZ and decongestants. Decongestants such as pseudoephedrine, phenylephrine, ephedrine, and nafazoline can increase your blood pressure and heart rate, which means your blood pressure medication, like HCTZ, won't work as well. Statins and grapefruit juice. Statins are medications that are designed to lower your cholesterol. Drinking grapefruit juice can affect the medication by increasing the level of statins in your blood. As a result, you could be faced with worsened side effects while taking statins. St. John's wort and antidepressants. Using St. John's wort and antidepressant drugs can have a detrimental effect by causing increased serotonin levels in the body, potentially causing serotonin syndrome. This condition can produce a number of symptoms, including rapid heartbeat and high blood pressure. Antidepressants and antihistamines. Antidepressants, like SSRIs and SNRIs, and antihistamines can interact thanks to their effects on neurotransmitters in the brain. They can increase your risk of serotonin syndrome, which occurs when there are high levels of serotonin in the brain. Anti-seizure drugs and alcohol. The anti-seizure and anti-anxiety medication known as lorazepam is not safe to mix with alcohol. It can intensify the side effects of lorazepam, which can potentially lead to life-threatening events or circumstances. You should never mix these two drugs. NSAIDs and alcohol. NSAIDs and alcohol are usually a bad combo. NSAIDs usually come with a risk of stomach bleeding, especially when you take too many. Drinking while taking NSAIDs can increase stomach irritation while also increasing your risk of stomach bleeding. ADHD drugs and alcohol. You should never drink alcohol with Adderall together, as the effects can be dangerous. You are more likely to overdose, and on top of this, it can increase your risk of cardiovascular problems, respiratory infections, and heart failure. Anticoagulants and grapefruit juice. You should never drink grapefruit juice while taking anticoagulants like warfarin. The grapefruit juice can amplify the effects of warfarin on your blood, causing you to bleed more profusely, particularly in the case of an injury. Blood thinners and vitamin K. Blood thinners like warfarin should not be consumed with foods that are rich in vitamin K. Leafy greens like kale, and even broccoli pack a ton of vitamin K and should especially be avoided. The main concern is that vitamin K can negate the beneficial effects of warfarin. Hypothyroid drugs and any food. Thyroid medication can restore your hormone levels when taken regularly, but there's a reason you are instructed to take it up to an hour before eating. It turns out that food can block the absorption of the drug in your small intestines so that it won't work properly. Blood thinners and antacids. Antacids, including over-the-counter options, can interact with some blood thinners, more specifically, warfarin. Bismuth subsalicylate, also known as Pepto-Bismol or omeprazole, can cause increased bleeding as a result of taking warfarin, as antacids can enhance its effects. Nicotine and insulin. Smoking or even putting on a nicotine patch can have a dangerous effect on diabetic individuals. Insulin is often prescribed for diabetic patients who need more insulin in the body to control blood sugar levels, but nicotine counteracts that. Blood thinners and sulfa drugs. Using warfarin and sulfa drugs can increase your risk of bleeding, especially in elderly individuals with kidney or liver problems. Interaction between these drugs is possible as sulfa drugs can affect the body's ability to process the blood thinner properly. Turmeric and blood thinners. You want to avoid turmeric supplements if you are taking blood thinners, as turmeric can already reduce clotting in the body. Its anti-clotting properties will work in combination with your blood thinner, increasing your risk of bleeding. CoQ10 and blood thinners. Although it can be great for those suffering from diabetes, migraines, or heart disease, CoQ10 can affect a blood thinner's ability to work properly. It can actually prevent the blood thinner from working, allowing blood clots to form and potentially cause heart attack and stroke. Chemotherapy and Vitamin C. Those undergoing chemotherapy should not take vitamin C supplements or consume foods rich in vitamin C, as the nutrient can affect chemotherapy's effectiveness. While it can help prevent cancer when you don't have it, it can cause problems if you are trying to treat it. Milk thistle and insulin. Diabetic patients may think they are doing themselves a favor, but by taking milk thistle supplements, you can end up overdoing it in terms of blood sugar levels, ending up with low blood sugar. Low blood sugar can cause problems such as rapid heartbeat, anxiety, dizziness, hunger, and confusion. St. John's wort and migraine medication. St. John's wort can interact with migraine medicine like sumatriptan. When combined, the supplement can increase serotonin levels in the body, which can cause a variety of side effects from mild to severe. Dairy and antibiotics. You should never consume dairy while taking certain antibiotics. These dairy products can bind themselves to your antibiotic medication and affect its ability to absorb in the bloodstream. You should avoid consuming dairy 2 hours before and 6 hours after taking your antibiotics. Find more at alot.com.